guys, it's Bundengese here. This is Connekt Media Podcast. We're looking fresh, we're ready to inform you. If you want to be informed, if you want to know more, affect every day, stick around. We're here at Botshilu Private Hospital, Dr. Kalenga again. So make sure you don't touch that dial. Dr. Kalenga. Today we're talking about cervical cancer. Anyway, arvaye ba ile re botsa ditaba tso tsotlhe. Hello, hi guys, it's Bundengese here. Welcome to yet another beautiful and enlightening show. We're going to have so much fun. They love us and we love them. We're back here again. We're still chilling with Dr. Kalenga. My doctor, how are you?
You're fine, thank you. And you, sir?
Hey, you look nice today.
Thank you.
It shows that you had a beautiful night.
Well, naturally, yes. Yeah.
But doctor, you always fresh. You know, it looks like your job is so easy, the way you look fresh every morning.
It's important to differentiate home and work.
Okay.
Even if you have it tough at home, when you go out there to work, you must bring your A game. You shouldn't come and bring your crampiness from wherever you were, take it to work. No, it's not like that.
But I think it's also important when you get home, they give you the massage, you know. You make sure that your body relaxes, you know?
Yes, that's an example, but it doesn't mean that my wife, she's a great person.
Okay.
Yeah, she's a great person, a caring person. Yes.
No, but I can tell she's a caring person, I can tell. You know, sometimes you just look at the man, then you will tell what kind of wife or woman the man has in his life. All right, doctor, let's not waste time. We're still talking about health-related issues, especially when it comes to women. Today, what are we talking about, doctor?
We'll be talking about cancer of the cervix and how to prevent it, if at all we can prevent it.
I'm here to learn, hence I'm asking you. I'm here to learn and also teach our viewers few things about everything that is happening in their body. Can you at least maybe, first doctor, please introduce yourself to our viewers for those who missed the first episode so that they know what we're having again today.
Okay. I'm Dr. Kalenga Martino. I'm practicing at Botshilu Private Hospital here in Soshanguve. I did my undergrad at Medunsa, the non-Sefako Makato University. I finished and then I went to work to Uppington as an intern where I did my internship training there. And after I completed, I went to Mpumalanga, near Nelspruit, a place, a small place, it's a rural area. It's called Matibidio Hospital near Kraskop, about 50 kilometers from Kraskop, where I spent, when I went there, I was very disappointed when I got there. You know, you trained in town, you're used to town life, and then all of a sudden you end up in the bush. You are there, there is, all you see, it's just this small village and the bush. I was very disappointed. I got there, I told myself I will stay just for 1 year and then I will leave. Yeah. But as you get to know people, working, really, we ended up staying for 4 years in the place. Yeah, and then after that, I went back again to Medunsa to specialize in obstetrician gynaecology, where I completed in 2014.
Yes.
And that was the year when Botshilu was opening, and we came here, and then here we are. We don't regret it.
All right, you had a beautiful journey, doctor. Cervical cancer. I don't know what is cervical cancer. Can you please explain to us what is cervical cancer?
Simply put, when we say cervical cancer, it means cancer which originates from the cervix.
Okay.
Now, the most important now is to know what is a cancer. A cancer is an abnormal growth which has a ability to invade surrounding structures and also ability to can move from the area where it started to distant areas. That's what we call cancer, simply put. Yeah. Surrounding, what we say it's a growth.
Yeah.
There is what we call a benign growth, meaning a no cancerous growth, and a malignant growth, that is a cancer. And the difference is from the definition which I just gave for malignant growth.
Yes.
A benign growth would be a growth which is limited just to the area where it starts. It has a capsule. It does not invade surrounding structures. It will be confined. And even when we are operating to remove it, it's so simple. Let's take an example of fibroid. Fibroid, they are benign growth of a smooth muscle of the uterus. When you are operating on them, you just make an incision. You can just squeeze, it pops out. But a cancer, you don't do that. It's not going to come out because it's invading. It has finger-like structures going into surrounding areas.
Yeah.
Yeah. And then that ability to move from the area where it starts to distant areas, that's a cancer.
So, let's go back a bit, doctor. Is it, okay, what is it, is there anything that can help one to prevent cancer?
Okay, trying to prevent a cancer, one should first understand what brings it about. If we can understand the predisposing factors or things which favor the growth of the cancer, then we can plan on how to can prevent such from happening. Cancer of the cervix, about more than 90% of it is caused by a certain virus called human papilloma virus.
What is that?
It's a virus. Viruses, they are small particles. Viruses, they are particles which may have either DNA or RNA as genetic material.
Yes.
But then they thrive when they get into a host, then they combine with the host material to start replicating. They take the control. Yeah. Now, going back to human papilloma virus.
Yes.
It's a very infectious virus. It, unfortunately, sexually transmitted.
Oh.
Yeah, it's a sexually transmitted infection, human papilloma virus. There are many of them, and very infectious in a sense that it's not preventable even by the use, or we said sexually transmitted, by use of condom. Use a condom, you can still get it, unlike HIV.
Oh.
HIV use a condom. You will be most likely to be protected not to contract HIV, unless you are having the condom burst, and then there is a breach in the barrier, a laceration in the skin, a cut in the skin, then the virus of the HIV would be transmitted. But for HPV, human papilloma virus, even if you use a condom, the mere fact that the genital area of the partners come into contact, if those areas there is a virus, if it just touches to the skin of the other person, it gets transmitted. That's how infectious it is. But the good news is that human papilloma virus, even though it's very infectious, but the body can take care of it easily.
Yes.
Especially if the person is not immunocompromised. The immune system of the person is strong. It's very common in young people because they are very sexually active and unfortunately tend to have multiple partners. With that, they contract the virus. Now, when they contract the virus, the body, the defense mechanism of the host will naturally take care of it. Within 1 year or 2 years, the virus will be taken away. It's not going to be there. The body will have defeated the virus. It's only if a person has a repeated infection. then the virus will get incorporated into the cells of the cervix.
Okay.
The cervix has the covering of the cervix, the cells on the cervix. They are two important types.
Yes.
There is the outer side of the cervix, which has what we call squamous epithelium covering the outer side, and in the channel or the opening of the cervix go into the uterus.
Yes.
We call it a cervical canal. There we have a columnar epithelium.
Okay.
Then the area where we have the flat or the squamous epithelium coming into contact with the columnar epithelium, that area we call it transformation zone.
Okay.
And that area changes when a person becomes pubertal.
Yes.
With the hormones we talked about, the estrogen, then you have the inside of the cervix like opening, we call it ectropion. It's opening up. The cells which are columnar get exposed to the outside of the cervix. Then we have that transformation zone. Those cells, they have to undergo what we call metaplasia to become squamous. Then there is a lot of activity which takes place there, and then those activities then facilitate the incorporation of the human papilloma virus.
Yes.
And if it gets incorporated into the cell, as we said, it has only one type of nucleic material, then it will take over the control of the whole genetic composition. It starts now producing its own protein for its survival. It starts multiplying.
Yes.
Yeah. If you get to that level, then those cells in the transformation zone, they start becoming abnormal. And those abnormalities, we classify them into mild, moderate, and severe. We call them dysplasia, those abnormalities.
Yes.
Now, mild, moderate, and severe, we can also call them as CIN, standing for cervical intraepithelial neoplasia, 1, 2, and 3. Mild being 1, 2 being moderate, severe being 3.
Yes.
Now, if again, still nothing is done, a person goes through that process of having mild dysplasia, moderate dysplasia, severe dysplasia, and the next step would be cancer of the cervix. That's how it comes about. There are, as I said, that there are many human papilloma virus, hundreds of them.
Yes.
Then they are classified into two big groups. We have the low risk human papilloma virus and the high risk human papilloma virus. The low risk, they don't lead to cancer of the cervix. But in the group of low risk, we have two important ones which lead to genital warts. I don't know if you know what is what. It's
Doctor, I'm here to learn. I don't know.
Okay. You know cauliflower?
Yeah, no cauliflower.
Yeah. Those viruses, they can lead to growth in the genital area which look like cauliflower. That's what we call genital warts. Mainly we have type 6 and type 11. They cause that. Then we have type 16 of human papilloma virus, type 16 and 18. Those are responsible for about 75 to 80% of cancer of the cervix. Only those two. Yeah, we call them high-risk virus. And then there are many others, viruses, human papilloma virus, we mean, which are implicated in that. Then, as we see, more than 90% of cancer of the cervix caused by this virus. Yeah. Then, if we can try ways of preventing this virus to get incorporated into the cell, or to prevent it from getting incorporated into the cell, then we can win the battle against the cervical cancer.
That's what I wanted to ask you, Doctor. How do you prevent that?
Okay. We said the virus is responsible. Yeah. And it's very infectious.
Yeah.
but the body can deal with it provided the person is immunocompetent. Then one, we'll look at other factors which would favor the development of the cancer. Because the virus is there, then we see the age at which the person becomes sexually active. Very, very important.
Oh, okay.
The younger the person becomes sexually active, the higher the risk of developing cancer of the cervix later in life.
Oh.
Yes. That's the age, because in a younger person, the cells are very immature. The human papilloma virus can get incorporated easily in such cells and take over the control. Unlike when they've reached 21 years of age and upwards, that they are matured, the cervix, I mean the cells are, I don't know, resistant, then it will be difficult.
Let me disturb you a bit, doctor.
Yes.
Taba ya hore 18, ho na le 18 ho ya godimo. O ka nna wa tsena gara a span. Doctor are 21. Please continue, doctor.
Okay. Smoking. Yes. Smoking, as we saw it again in menopause and osteoporosis, smoking is implicated in the origin of many cancers, including cervical cancer.
Yes.
That will then also contribute. Okay. The issue of multiple partners is very complicated because you may have one partner, but then that partner is having many partners. Then it becomes like you are at risk. You are, let's say you are a woman, you are having this gentleman as your partner, and you know this is my only partner. But then he has other partners. He's going to bring the human papilloma virus to you. Then it becomes a bit difficult.
Yeah.
Now, then how then do we prevent cancer of the cervix? One is by delaying the debut of being sexually active. Young people should not engage into sexual activity.
Must stay away from sex.
Yes, they shouldn't. The longer they delay that, the better.
Yeah.
That's one. Two, smoking. They shouldn't be smoking. Smoke, again, you predispose yourself to the development of cancer of the cervix.
Yeah.
Three, we have now the vaccine. We said if we could prevent this cancer, this virus from getting incorporated into the cells of the cervix, then we would prevent that 90% of cancer of the cervix. Then there is a vaccine, or there are vaccines to inoculate. What is a vaccine? A vaccine is let me call it substance. It can be produced from the virus itself. Take some pieces of the virus, so that they introduce it, but pieces, not the whole virus. Or they can take a virus, but they've attenuated it, meaning they render it no infectious, so it does not cause disease in a person. Then they introduce those particles in the body of a person to stimulate, because when the body sees that foreign body, will react by producing antibodies. Then when the real virus comes in the body of the person, those antibodies, then they will attack that virus to render it inactive to cause the disease, unable to can cause the disease. That's a virus. That's a principle of formation of the vaccine. There are vaccines which can be given to prevent the human papilloma virus from getting incorporated into the cell. And when do we give these vaccines? That's the most important. We said sexually transmitted infection, therefore it should be given to people who are not yet sexually active. Yeah, because if they are sexually active, they are most likely, because we said it's a very infectious virus, and very common in young people. Once they become sexually active, they are most likely to come to be infected. And once they are infected, it becomes difficult. It's no longer again the vaccine. It's not going to fulfill the function of the vaccine as we know it.
Yes.
Yeah. The ideal age, they say between 9 and 12 years, 12, 13 years of age, that's the time where the vaccine should be given before they've become sexually active. Now, we said the virus takes over the control of the production of the genetic material. And then once it starts producing that, it will produce a certain protein. We call it a protein E and protein E, 6 and 7, which then would inactivate. The body has ability to deal with abnormal cells.
Yes.
Because during the, I don't know if you know, I don't know if you did biology at school.
Yes, doctor.
Do you remember mitosis?
Yes.
Yes. During mitosis, there is duplication of genetic material, and during that process, some errors do happen.
Yeah.
When they happen, the cell may acquire ability to become autonomous, to start multiplying at a high speed and in an uncontrolled way, and that may lead to cancer. Now, the body has a defense mechanism built in it. We have a protein like a P53, which would then deal with those abnormal cells, get rid of them. We call it apoptosis, programmed cell death. Now, if then there is the human papilloma virus is in the body of a person, producing those protein E. The protein E then will render the P53 unable to clear up those abnormal cells. Yeah, and those abnormal cells now they start thriving because there is nothing to stop them.
Yes.
And that's what leads to cancer. Then basically is this virus. We'll stop it, then we'll do a great deal. Now, we said delay sexual debut, no smoking, administering of the virus. There are people, there are many places in the world where the virus, I mean the vaccine, it's a dream. It will never reach there. People, the community are just so poor that countries are poor, where even the basic, life, you start with the basics.
Yes.
It's food, shelter. Once you reach those, then you start aspiring to other levels of living.
Yeah.
Now, if you can't have even a shelter, can't have food, where are you going to get this vaccine from?
Yeah.
Who will give it to you? No one. Then there are things like screening for cancer of the cervix, so that if to pick up those abnormalities I talked about, the CIN 1, 2, and 3, then the role of the pap smear becomes important.
Okay.
A pap smear is a test which is done to discover those abnormalities and deal with them before they reach to cancer. Yeah. Now, pap smear, again, it's like a luxury in other places.
Yes.
In America, they say from the time a person becomes sexually active, 3 years later, they should have a pap smear done. 3 years later, because we say the virus very infectious. Then if you can pick up abnormalities, you deal with them.
Yes.
It's costly also. It means manpower. It means that's human resource, and you need also technical know-how. Not everyone is trained. The pathologists, there are very few, especially here in Africa. We don't have many pathologists. There are countries where they will tell you they have 1 or 2 pathologists. South Africa, we are blessed. We have such facilities. But there are many countries here in Africa where pathologists, you can count them for the whole country on the tip of the fingers. And those are the people who get to analyze these things to find out if there are abnormalities. Therefore, there are people who might not even have a chance to have a pap smear. Okay. Here in South Africa, because of the constraint, we used to say from age 30, then a pap smear, if a person doesn't have any problem, by age 30 they should have at least 1 pap smear done, and thereafter every 10 years, 3 pap smear in their lifespan.
Yes.
But then there are those which we call opportunistic testing. If a person comes in for other reason, chronic pelvic pain, infection in the genital tract, then you would offer also to do a pap smear, and then you check. If you find that there are abnormalities, then you deal with them. Those CIN 1, 2, and 3. CIN 1, without presence of human papilloma virus, ideally to repeat the pap smear between 3 and 6 months, so that you see, most often they will regress, they will become normal in CIN 1 and 2. But in CIN 2, if you repeat the pap smear between 3 and 6 months, about 50% of them may become worse than that. The CIN 3, it's the opposite of CIN 1. When you have CIN 3, you repeat the pap smear between 3 and 6 months, majority of them will have progressed to cancer. Then it becomes important now to come up with a way of dealing with these different categories. In CIN 1, no presence of human papilloma virus, repeat the pap smear. You don't have to be aggressive. CIN 2 and 3, there you have to do what we call colposcopy and biopsy. Meaning, as we said, we take a sample from the cervix, from the transformation zone. Therefore, you have now to take a sample to go and remove that area, because that information you are getting is telling you what is happening in that area. Then you take a person to, you can do it in the room, or you can do it in theater. In the room, you need to give, I'm not going to go through the whole process, but I'll just go straight to the point. You give local anesthetic so that when you are going to be cutting, the patient shouldn't be in pain. You inoculate the cervix, then you apply acetic acid, you will see the aceto-white transformation, then you remove that area beyond the aceto-white margin. You remove that area, then you send it for histology. Sometimes you may get a patient, it says CIN 2 or 3. When you do that, you send to the laboratory for examination. They tell you that there is already a cancer. Then the purpose of that is twofold. One, therapeutic. As you are removing, you remove the whole abnormal area. You have, in inverted comma, treated the patient. Two, also you do the diagnosis to go and analyze, is it only the CI, was it indeed only the CIN 2 or 3, or was there already presence of a cancer? If, say, it was only dysplastic cells and you have removed the whole of it, that's fine. Then you have to repeat again the pap smear after 6 months to see what has happened. If it comes again fine, then we will repeat the pap smear after 1 year. But in the case that you do the colposcopy and biopsy, and then it tells you that there was already cancer of the cervix, unfortunately in such patient, then you have to refer to a cancer specialist for radical hysterectomy.
I wanted to ask you, Doctor, we spoke about how to prevent it, and I just wanted to find out if we have a cure for that, because I think we've had so many stories whereby people died because of cancer and stuff, you know. So how dangerous it is, and do we have cure for that?
Yes, cancer is dangerous. That word cancer is not a joke. It is frightening when a person is told you're having cancer. But it doesn't always mean that if we say a person has a cancer, definitely this person is going to die tomorrow. No. The best thing about cancer is, one, in this case, to prevent it if you can. Two, discover, deal with abnormal cells before they get to cancer. Three, if it's there, it depends now at which moment do you find out that she's having a cancer, at which stage of the cancer do you find out. We said a cancer, it's abnormal growth which has ability to invade surrounding structures and move to distant areas. And those are different stages. We have stage 1, 2, 3, and 4. Now, when, especially like cancer of the cervix, early cancer, you can operate on the patient, remove everything. By that we mean you do the hysterectomy, ovaries, do a lymph node dissection done by oncologist. You do that and the person is cured. It only becomes a problem with advanced cancers.
Yes.
When it advanced, unfortunately, you may just, when you do, you don't do it really with the aim to cure the person, but to prolong the life of a person. Because if it has gone to the, when we say distant metastasis, we mean it can go to the pelvis, it can go to the lungs, it can go to the brain. Once it has reached the brain, really, it will be just for palliative, alleviating the suffering of a patient and prolong the life of a person for as long as you can. Yeah, earlier you can. You find it earlier, you can do the operation. It can be just surgery or surgery and chemoradiation, and the person can be cured and they are fine.
Yeah, doctor. I think we're always learning with you, you know. The other day I told you, have a diary with you. Oh, make sure, hurry, phone on the data so that you can Google some of the things that he's talking about if you don't know anything about them. And we have questions, but before, I'm questioning. This is Connekt Media Podcast. I'm with Dr. Kalenga. We're coming back. Welcome back, guys. I'm still chilling with Dr. Kalenga. If we're talking about cervical cancer. So no get to questioning. Doctor, I was checking some of the questions that we have here, and I'm just gonna read this question, but I think you already spoke about it. You know, if maybe there's something that you didn't talk about it regarding this question, maybe you will just mention it. It's a question from Lerato. She says, "What exactly is cervical cancer, and how does it develop?" I think you answered that one. And she says again, "Is cervical cancer common, and who is at high risk?" I think you also answered that one. All right, let me go to the next question. It's a question from Bridget. She says, "Are there lives?" I think you also mentioned this one, but you'll add if you have to add. Okay. Are there lifestyle changes that can reduce the risk of cervical cancer? Can you explain how the HPV vaccine works and who should get it? You also mentioned that one, right? Yeah, no, I think you covered a lot of things. Okay, another one, it's from Amza. She says, "What are the recommended age and frequency for cervical cancer screenings? Are there alternative methods for cervical cancer detection besides pap tests?" You mentioned it, but I think maybe this one, maybe if there's something that you can add on it, I don't know.
Okay, I think most of the things we have already spoken about them. Yes. We have covered. Appropriate age for vaccine, we said ideally before sexual debut. Yes. 12 years of age and upwards. But then they try to extend up to 25 years of age, but it's not ideal. The key should be before a person becomes sexually active. Then it will prevent better the human papilloma virus from getting incorporated into the body of a person. Yeah. Okay.
So we have Dumelo. Dumelo says, how is HPV transmitted, and can men also carry and transmit the virus? Is it possible to contract HPV even if you are in a what is this?
monogamous.
Thank you, doctor. You see, I told you that I'm here to learn relationship, yes. But you also spoke about that a bit. But yeah.
Yeah, human papilloma virus is a sexually transmitted infection. As we said, it's very infectious to a point that even if you use a condom, you can still contract it by mere fact that the genital area of the two partners come into touch. It can be transmitted. Yes, men. That's why we call it a sexually transmitted infection, because it can come from a man, or it can come from a woman. Yes, you may be in a monogamous relationship, but still get it if your partner, you are not the only one in that relationship. Your partner may have other partners. Then if those partners have other partners, then infections will be transmitted. In a man, yes, it can cause, like in women, it can cause condyloma, what we call the genital wart. It can cause also cancer of the genital area in a man. Yeah.
All right. Yeah, doctor. I think you covered a lot. That's one thing that I also like about you. You know, when we have questions, you answer the questions before we even tell what are the questions. So I'm just checking here. We also have let me see. We also have Martha. Martha says, what are some early symptoms of cervical cancer that women should watch out for? Do these symptoms always indicate cervical cancer, or could they be due to other conditions?
Yeah. The precancerous changes, the dysplastic cells, they've got no symptom. At that moment, you're not going to have any symptom.
Yes.
By the time you start having symptoms, often it's too late. The commonest one would be contact bleeding. Yeah. By that we mean when you are intimate, because the cancer starts most often in the transformation zone at the mouth of the cervix, of the womb of the cervix. That way it starts. Now, when you are intimate with the contact, then a person would bleed. After you have been intimate, you bleed, you must be checked. Yes, there may be various reasons why a person may bleed. We spoke yesterday about menopause and the dryness. Dryness, the friction can be tears in the genital area, the person can bleed. But it's important that the person get checked so that we see. Normally, when you are examining a patient bleeding, okay, you examine from outside the vulva, you check inside, you pass a certain instrument which you call speculum, which you pass. As you are passing it, you are examining also the genital tract to see any lesion on the genital tract, meaning the vaginal wall. You get inside, you look for the cervix, you look at the cervix, do you see anything? If, let's say, you see there is a lesion, then at that moment you have to do what we call biopsy. Biopsy basically is cut a piece of that lesion which you see, send it to the laboratory, then they will analyze it, they will come and tell you. It could be just a wart, it could be a schistosomal infection, or it could be a cancer. That's how you do. Now, as we said, precancerous lesions, you're not going to have any symptom. When the cancer starts developing, the earlier sign you will have is contact bleeding, bleeding after intimacy. When you start experiencing pain, it's advanced cancer. Then now you start having involvement of the pelvic area, the parametrium around the cervix, the tissue around the cervix going toward the outside to the pelvic wall. Complications later on, you may have what we call rectovaginal fistula, basically the rectum communicating with the vagina. Then we have fecal material coming through the vagina, and those are advanced cancers. Or you have vesicovaginal fistula. That's a communication between the bladder and the vagina. Those are advanced diseases. Basically is you bleed, consult. Don't wait, because it's people who delay. You wait, you're having abnormal bleeding, you delay. You are having pain, you delay. By the time you go to the doctor, it's already stage 3, meaning it has gone to the pelvic wall. The rectum is getting involved, the bladder is getting involved. That is advanced disease. And if you delay again, then it moves from there to the liver, to the lungs, to the brain. We don't want to get there. Yes. And today, really, medicine has evolved. We shouldn't be receiving advanced stages of cancer, especially for cancer of the cervix, as it can be prevented, it can be discovered earlier, and it can be dealt with and achieve curability. A person can be cured from it. It's only if you delay, you neglect, then unfortunately it's advanced, then it becomes a palliative treatment.
Yeah, no, this is scary, doctor. This is scary. We also have a question from a Blessing. She says, can all cases of cervical cancer be attributed to HPV infection?
No. We said there is a small percentage. It's a bit depend on which book you read, which source you get. Majority of books, they will say more than 90%, but there are others will say up to 99% of cancer of the cervix are due to because of the human papilloma virus. But the bottom line is that majority of cancer of the cervix are caused by human papilloma virus. It's a small percentage which is caused by other things like genetic, even and other carcinogenic substances.
Because I see there's another question also from him. She says, is it true that most HPV infections clear up on their own without causing cancer?
Yes, as we said, very common sexually transmitted infection, but not very virulent in a sense that the body can clear it naturally. Within 1 to 2 years, it clears up without any problem. It's get to cause the cancer if it's a persistent infection or recurrent infection. You get you contract it today, it clears up. You contract it again, it clears up. Yes. But eventually, it's like I don't know. The body gives up and say, "You now you're not listening. You're on your own." Then the human papilloma virus takes over. Then it renders the p53 protein unable to clear up those abnormal cells. Then it's one way. Once you get to that level, it's one way to cancer if nothing is done.
I think you also covered this one, but you will add on it. It's a question from Mamiki. Mamiki says, if cervical cancer is detected, what are the available treatment options? One, how successful are treatments for cervical cancer, and what's the prognosis?
A cancer which is detected in its early stage, the prognosis is excellent. Cure can be achieved. You can do what we call a radical hysterectomy, and the person is cured, free of cancer, can die later on of something else. It's only when the cancer is advanced, then now it becomes a combination of medication. The aim might not be to cure the person, but to prolong life and better life, pain-free life. You do what we call, when it's advanced beyond, you might not have to do surgery because every tissue you touch there is just friable. You touch it, breaks down, touch it, breaks down. Then it's radiation. You do radiation and chemo.
Okay.
Yeah.
Chemotherapy.
Chemotherapy, yes. Chemotherapy and radiation. That's what we do when it's advanced,
Okay, I think you also covered this next question. Daisy, she says, can cervical cancer affect the young women? I think you covered this one. Or it's more common in older age groups. You covered this one. And another question from her is
maybe I may add something there.
Yes.
Yes. Generally, cancer is a disease of senior people.
Yes.
Yes, we know there are cancers which affect kids. and mainly like cancer of the cervix.
Yes.
We used to see it in the past, 35 years of age upward. That way it used to be very common. But with the advent of HIV, especially when people were not on treatment, we said the immune system will take care of the human papilloma virus. When the person's immune system is a challenge, being it HIV or any other cause, then the virus will not be killed. Then it will be incorporated. I've seen a patient when I was at George Mukari. We lost a patient at 21 years of age, cancer of the cervix. Yeah.
Another question from Daisy. Is there a difference in screening recommendations for women of different ages?
Okay. As we said, the American recommendation, American College of Obstetrician and Gynaecology recommendation is that from the time the person becomes sexually active, 3 years later they should start having a pap smear. Then recently they've added something where we test. We don't do just the pap smear alone. Do the pap smear plus the human papilloma testing. When you do that, you combine the two. They recommend starting from 25 years of age. When you do that, the person, if it comes, everything is fine. Then they will repeat it again at 35. It's 5 years, every 5 years. Then you repeat every 5 years. But again, it's only if it's fine. If it's not fine, you have to repeat it either after 3 months or 6 months. Yes. If you do the pap smear alone, that then you do it alone without the human papilloma virus testing.
Yes.
Then you do it yearly.
Okay, we have also 2 questions from Soli. Finally, a man is asking a question. Are there genetic factors that can increase the risk of cervical cancer? That's question 1. And 2, someone mentioned smoking earlier. Can smoking increase the likelihood of developing cervical cancer?
Yes, it does. Like smoking is implicated in many cancers, including cervical cancer. Yeah, genetic, it's very minimal, as we said. The bulk of cancer of the cervix is caused by human papilloma.
Let me disturb you, doctor. Speaking about smoking, can we also include the herbally there if it's herbally is also dangerous, so that people understand? Because there's so many stories out there that are being told and they're not even clear. So I'm happy that I'm with you today. You can clarify that for us.
Yes, when they were promoting the herbally, these things herbally, they were saying no, it does not cause cancer, but evidence is coming out now. The research which they are seeing young people who are smoking those things developing lung cancer. Yeah, it's linked to cancer. There is evidence. Yeah,
guys, I think now you understand. I'm with the doctor, not the things that you read on social media. Herbally is dangerous. Herbally causes lung cancer. That's right, Dr.
Yes.
Right?
Yeah.
Thank you. At least now you know. Okay, we have another question from Princess. Princess says, can women with a history of cervical cancer still have a healthy pregnancy? How does cervical cancer affect fertility and childbirth?
Yeah, for women who don't have kids and they develop cancer of the cervix, provided the cancer is in its earlier stage, and its earlier stage we mean confined to the cervix, there is what is called trachelectomy procedure, through which they can go and just remove just the cervix. Yes, with support they can still have pregnancy with cerclage and have a child. It's possible. That's why they do trachelectomy, a procedure where they remove just only the cervix to preserve the uterus with a hope that she can become pregnant and carry the patient to the pregnancy to term. Yeah.
Okay, one last question. Yeah, this is the last question. It's Gloria. She says, what can individuals do to raise awareness about cervical cancer in their communities? That's one. And two, are there organizations or campaigns focused on cervical cancer prevention?
Okay. Basically, before we can reach communities,
Yes.
we are in our families. In our own families,
yes.
try to inculcate in the behavior of our children that they must delay, they mustn't become sexually active at a younger age.
Yes.
Make them understand. And then with that, then we can take it to community, then we go like to schools, we expand it to schools, workplace. But when we talk of workplace, we're already talking about big people. But still, again, we can get 19 or 18-year-old who are working. Yeah, that's what we can do. Yes, like here in South Africa, there is a campaign run by the Department of Health, vaccinating young children. It's already being done, so that we prevent the human papilloma virus, as we have seen. It's the culprit in the development of cervix. Yeah.
Yeah, no, doctor, I think we learned a lot, and I think most of our viewers answered their questions. And guys, this is what I always say, check us on social media. If you have questions, obviously we'll be posting on social media if we're going to interview another doctor and have questions. If you have questions, we'll tell you the topic that we'll be having on that day. If you have a question, you can just post your question on our social media platforms so that we can type it down and ask the doctor when we do an interview. Doctor, thank you so much for your time again.
You're welcome, sir.
Yeah, your patients are waiting for you outside. I can see them. They're busy passing, checking out there. So I think they're waiting for you. Are you ready to do what you're good at?
Definitely I am. Thank you.
Yeah, I really enjoyed spending time with you, doctor, and I also learned a lot, and I think moving forward, I'll be able to do things differently, even if I'm a man, I'm not a woman, but yeah, especially because I'm married, so obviously I will know how to deal with certain things at home. Okay. Guys, thank you so much. I believe you enjoyed this episode. This is not the end. We're coming back again. We're still going to talk about so many things. This is Connekt Media Podcast. My name is Spook Ndengese. Let's meet again. Remember, don't forget to check us on social media. By episode. Social media handles. Happy Tango.